My name's Nadine Griffiths. I'm a clinical nurse consultant at the Children's Hospital Westmead in Graceland for newborn intensive care. And the way we think about a neonatal intensive care unit is it's a neuro-intensive care unit. Babies' brains grow by about 64% in the first 90 days of life, and there's 250,000 neurons connecting every minute. So everything that gets laid down during this period affects you for the rest of your life. And that's linked to the first 2,000 days, and this global movement around what happens during this period influences your trajectory for life. So your health outcomes, your social outcomes, your work-related outcomes, etc. My research is called the Echidna Study, or the effects of caregiving for infants in a developmentally supportive neonatal setting. And my research is really looking at caregiving for infants, parents, and staff in the surgical NICU, and it's providing all of those groups with an opportunity to contribute. And we chose the Echidna acronym because echidnas are incredible parents. Their mum actually digs a burrow for the little baby echidnas once they have spikes, and the mum continues to care for the baby echidna for up to a year, so 9 months to a year. And the reason that's so important is because that's what we're fostering in the NICU, is these incredible relationships between infants and their parents. So we're really starting to wind it back and go, these are the things we know make a difference. Parents make the biggest difference of everything. The place where you grow up makes a really big difference as well. But in the neonatal intensive care unit, we're really starting to pull it back to things like developmental care, caregiving, because these are the consistent things that happen. And we need to know what about these things makes your outcomes potentially better or may adversely affect your outcomes. So I'm part of this space that's really, really interested in how we can better support the baby's brain. 59% of all healthcare professionals are nurses, and that means there's 28 million nurses across the world who influence healthcare and how healthcare is delivered. So for me, it was really important that there is research conducted by nurses that is designed to support and improve nurses' experience. And my research is exploring the experience of parents and infants and nurses in the surgical NICU with the goal to positively impact their experiences. And as a nurse delivering education on developmental care, it's really important to me that we learn what works and what makes a difference clinically and in the longer term for the babies. So my research will provide valuable information about caregiving and infant behavioural and physiological responses to help us determine what the best education programs are to support caregiving in the surgical NICU and hopefully beyond. We know that research is a highly competitive environment, that funding and grants, while there are millions and millions of dollars of grants available for the everyday researcher, they are often out of reach. And so the Cerebral Palsy Foundation helps make sure that these grants can be utilised in real time by clinicians and healthcare workers or researchers to make a difference within the clinical setting and within the broader healthcare setting. So it's very rare for nurses to receive funding as part of their PhD. And so for me, it was incredibly overwhelming to think that someone saw value in my research and could see the potential, and that they were willing to help support me on this journey. I now have space and time to conduct my research. I have actually been able to employ a research assistant who will be working with me for the 18 months and help with recruitment and data entry and setting up of the equipment that is associated with my research. It's also helped ensure that we could use platforms and some of the tools that are necessary to conduct my research. And it's really ensured that this is a high quality research project, and it's really broadened the scope of what I could offer. I would really encourage any researcher or any clinician who's looking to undertake research to consider partnering with their Cerebral Palsy Alliance and to applying for one of their grants. The Cerebral Palsy Alliance are really motivated and looking for opportunities for unique research that supports children in their early years and into adulthood. What I would really like to express is my incredible appreciation to the Cerebral Palsy Alliance for this grant, to the donors who have contributed money that makes these sort of grants possible. I know that sometimes you don't know where your money goes, and this is an incredible place for your finances to go to make a difference, not only for one interaction, but hopefully for multiple interactions for many years. And especially as a nurse, my understanding is I am the first nurse to have received a grant of this kind, and I am so exceptionally grateful, and I hope that I am the first of many nurses who partner with the CPA to deliver research.